So what is the benefit of exercise? So it's called as primary prevention. So they have done these studies here. Then a person who is walking briskly for 30 minutes a day for 5 times a week has 30% reduction in any vascular event. Vascular event means any heart attack, any stroke. So 30% reduction, my friends, if you are walking for 30 minutes every day for 5 times a week. If you have 3 hours of brisk walking a week, 1.5 hours of vigorous exercise per week. So that is how the calculation is. Resistance exercise and weight training are also very beneficial. So if you are going to gym, this is also very beneficial to your health. Now the cigarette smoking, as you can see here, this is not a secret, but what it does, what does cigarette smoke do? It increases BP, decreases HDL, damages the arteries and blood cells, increases heart attacks. Cigarette smoke contains more than 4,000 chemicals, and 2,000 chemicals are poisonous. If you think you are smoking a cigarette, you are mistaken. It is the other way around. Cigarette is smoking you. So cigarette is taking your life. Alcohol consumption, my friends, again, alcohol consumption is also very dangerous. Okay, so there is a very fine line between the 1 to 2 drinks per day and the larger consumption. So, but what happens is, whenever I see in my regular practice, whenever a patient is addicted to alcohol, he never stops at 1 to 2 drinks as the Western population, and therefore it's better to avoid alcohol altogether. Diabetes, again, diabetes is a very deadly disease. Patients with diabetes have 2 to 3 times risk of heart attack. A diabetic is more likely to die of a heart attack than non-diabetic. 80% of diabetics die from heart disease. Risk of sudden death from a heart attack for diabetic is same as one who has already had a heart attack. So interactions of risk factors, again, if you have multiple risk factors, then more the chances that you get heart attack. So risk is you can control. As I was telling you, you can reduce your cholesterol. We have our cholesterol control program where you can reverse your cholesterol levels. Blood pressure and diabetes programs also we have where you can reduce the blood pressure and diabetes. Then for smoking cessation, you can definitely have more self motivation. We do have programs for smoking addiction also. Weight reduction is very important. We have programs for weight loss. Symptoms. So warning signals for heart attack. So there is chest discomfort, then discomfort. The chest discomfort is seen as a very heavy weight or an elephant sitting on your chest. So there is a big pressure which is there on your chest. There can be burning, there can be heaviness, discomfort in the upper end. The radiation to the jaw is very common in heart attacks. The warning signals can be shortness of breath, there can be sweating, nausea and lightheadedness. So how do you prevent a heart attack? So what are the general principles we have just discussed? Sugar to be replaced by complex carbohydrates. Fiber should be an integral part. What foods? So whole grains are very important. Whole grains have a lot of fiber. Do not use reused boiled oil or hydrogenated oil. So all the packed foods which we eat, all the chips and the farsans, these are all been made in reused boiled oil. So in factories, they are again and again heating the oil. So this causes a lot of saturated fats which are there inside this reboiled oil. Grill, boil, bake, cook in water or in microwave. Don't deep fry your items. So they are tasty but again very dangerous. Use non-stick cooking ware. Reduce portion size daily. You have to eat fresh fruits and raw vegetables daily. Don't eat fried snacks such as chips, savories and sweets. So this is the food glycemic index. If you are eating a lot of sweets, then the glycemic index is very high and leads to insulin release in your body. And that causes obesity in a lot of people we see. So the food pyramid you can see at the base of the food pyramid is bread, cereals, rice, pasta group. Then the vegetables servings 3 to 5 servings per day. Milk, cheese and yogurt very minimal, very sparingly. Then you have dry beans, nuts. So again this is very sparingly, and fats and oils and sweets. This is at the top. So this is how your plate should look at. Fruits, vegetables, fruit sugars are safe. Fruit pulp is to be eaten. No canned foods, no juices. You can gift fruits whenever you go and gift somebody. We normally what do we do is we take sweets. So what you can do is you give fruits to your friends. Offer fruits as courtesy. Eat fresh cut fruit, vegetables, fruits and vegetables. Snack on fruits, nuts. Don't put overcook vegetables. Reduce simple carbohydrates. Fruit give lot of potassium. Use soups and buttermilk. Again, portion size is very important. Portion size, you need to reduce the portion size. So more the portion size, the more the calories you need to burn. So you can see here that if you have 400 calories to burn, you have to walk for 2 hours. So preventing heart disease, rule number 1, look before you eat. Then these are the dietary guidelines. Avoid fat and organ meat. Avoid non-vegetarian food. Then avoid butter, cheese, malai, rabdi. These are the foods that you need to avoid. Then which oil to be used? Rotate the oil, or you can have mixture of oils. Best oil for cooking in India is not olive oil. We mistake it. Olive oil is not very good for cooking. It is can be used for garnishing. So you can use groundnut oil, or you can use canola oil, mustard oil. These are the oils which are easily available in India. So sunflower oil is also good. So these are the type of fats which are there: saturated fats and unsaturated fats. So rule number 2 is exercise. We just spoke about it. It reduces the risk for any heart attack. Exercise, exercise, exercise. So it is very important. Your mortality comes down. Okay, so if you don't have in your busy schedule, if you don't have time for exercise, then you will have to have time for disease. So this is very important. So walking is very good for heart. So you need to go and exercise daily. Do your cardio. Stop smoking now. Rule number 3, very important. So again, very important that you need to stop smoking. Okay, so cholesterol should be less than 200, LDL should be less than 100, LDL more than 400, more than 40, triglycerides more than 200. So these are their target numbers. So if you do lipid profile, these are your targets. 10% reduction in blood cholesterol reduces 20 to 30% decline in coronary heart disease deaths. So it's very important that we reduce blood cholesterol. Controlling BP is also very important. Optimal BP is 120 by 80, my friends. So you need to maintain your BP at that level, 120 to 80. Controlling blood pressure, blood sugars are very important. Fasting blood sugar should be less than 100. Post-meal blood sugar should be less than 140. If you are having diabetic, see to it that you take your medicines properly. Or if you want any diabetes reversal program, you can contact us. We definitely have diabetes reversal programs. If you are someone in your family who are already diagnosed with heart disease, don't get disheartened. If you have proper lifestyle management, your chances of having the same illness goes down very substantially, my friends. So these are the different prevention methods. Stop smoking, choose good nutrition, be physically very active every day, aim at healthy weights, manage your diabetes, very important, reduce stress, limit alcohol, make sure you get enough sleep at night. This is very important. In Indians, we have seen that they don't sleep properly at night, and lowering BP is also very important. So if you get heart attack, what do you do? So again, this is the heart. You can see this is the heart, and this is pumping blood through the whole body. So walking is very important, my friends. Go for a walk every day. Walk whenever you get a chance. Climb staircases. This is very important. Go for skipping by ropes. Again, this is very important and help you maintain your cardiovascular health. So this is a exercise called as burpees exercise. This is again for cardiovascular health. Very good exercise, burpees. Do this at least 2 minutes every day, 120 seconds non-stop. Again, your physical activity every day is very important. Track it. 10,000 steps every day. This is very important whenever you are walking. Treating a heart attack. Again, you can treat a heart attack by doing primary angioplasty, or another treatment which we have. So these are the how the stents look like. So this is the stent when it is implanted in the artery. So this is by primary angioplasty. And my friends, we have a non-invasive method which is called as EECP. So again, EECP we will discuss in detail regarding the same. So if you have any queries regarding this treatment, you can contact us in the given numbers. Thank you.